this is Dr. Mandy Kirk from Move to Success Physical Therapy. I just made a torticollis video and released it on my channel. So if you'd like to check that video out, it is on my channel as well. This is actually just a follow-up to that video. So after I uploaded the video, I had a moment of realization that, oh, I forgot to mention positioning corrections for torticollis. So this is something super, super easy that parents can do at home. And I let all parents know when they come in for their evaluation that there are some positioning changes that you can do with your infant that'll help them to keep their head in midline and to rotate to the correct side. So just a quick review of torticollis. Torticollis is a tightness of the sternocleidomastoid muscle, and it involves a tilt to one side and a rotation to the opposite side. So the rotation component is something that's easier to correct with just a positional change than the tilt is to correct. The tilt we kind of have to work on with stretching and strengthening activities, and I reviewed that in my previous video, so take a look at that if you'd like some exercise ideas. But this is specifically for positioning changes. So let me grab my little infant baby to talk about it. So just some simple positioning changes that you can do around the home. Feeding. So if baby is breastfed, try to position them in a way that they have to turn their head the opposite direction of their preferred side to feed. So if baby consistently keeps their head rotated to the right, you want to position them so that they have to rotate to the left to be able to feed. Food is an awesome motivator. So for positioning to get them to rotate towards the left, you can position them and kind of roll them off to the side so that they have to turn their head that direction to be able to feed. And then when you go across the body, you can go this way to get them to rotate. So positioning, same thing with bottle feeding. So instead of breastfeeding, you would just place the bottle in a direction that they would have to rotate towards the side that they're less comfortable with to feed. And then the other thing is tummy time. So tummy time is a whole another aspect that a lot of kiddos with torticollis are slightly uncomfortable in tummy time. It could be because of GERD or other positioning issues with the esophagus, that they tend to be a little bit less comfortable in tummy time than other babies. It's not a hard and fast rule, but there are some tips for tummy time in the core strengthening episode that I have on my channel as well. But in tummy time, you can position things so that they have to turn towards the side that they like less. So little infants, the best motivators are a mirror. So you can put a mirror on the ground or a mirror elevated just a little bit so that they can see themselves, or actually you get down and have them rotate towards you. So mom and dad are the best motivators as baby is tiny, and then as they get older, you can position their favorite toys so that they have to turn their heads when they're in tummy time to look at those toys. And then feeding, we talked about breastfeeding, but you can also, when baby is old enough to sit in a high chair, kind of position the spoon so that they have to turn their head to take a bite. And the other thing is sleeping position. So I tell parents not to really worry about changing baby's head position and sleeping. We want safe sleep more than anything, so don't put anything in the crib to prop or position baby's head. However, place baby in a way that if there's anything fun in the room, a mobile, or like baby's crib is pressed up against the wall on one side and there's interesting things on the other side, position baby so that they have to turn away from the side that they prefer to turn to be able to see those things, so that when they're laying down, they wake up in the morning, they're going to rotate towards the direction that has the more interesting things. Okay, so those are my positioning tips for home for torticollis. Feel free to like and subscribe to this channel and ask me any questions in the comments. If you have other questions about torticollis, they may have been answered in my previous video on the channel. If they weren't touched on, feel free to ask questions in the comments. And if you have any other videos that you'd like to see, mention those as well, and I'd love to do follow-up videos. Thank you for your time. Bye-bye.